Good morning, everyone, and welcome back to the IJIS National Symposium. In case you might be joining us for the first session or for this as your first session, know that you are now going to be participating in our first town hall that addresses responding to the ongoing threat of the COVID-19 pandemic. You may recall, you may have participated in, or I will share with you the fact that in the summer of 2020, I just put on what was a mid-year briefing that brought together different facets of the public sector domain to discuss with us their experiences, their challenges, how they dealt with the good, the bad, and the ugly, and how they ultimately responded to the critical needs of their individual jurisdictions or the domains that they represented. Today, we continue that dialogue with 4 different members of similar or different domains, and I'll sort of highlight those in a moment, to continue the notion of how they have progressed, where they see the priorities emerging, and what recommendations they would provide us, the IJIS community, in order to support the needs going forward. As all of you know, as I discussed earlier this morning, the objective of these sessions, of these summits, of the IJIS mission is to collaborate and partner even better between public sector and private sector in order to better meet the operational priorities of the constituents. So to that end, this morning we have Dr. Bill Hazel that will usher, MC, moderate, and overall deliver the town hall session for us. Bill Hazel is the former Virginia Secretary of Health and Human Resources, and he is the current Senior Deputy Executive Director of the Claude Foundation. I can spend a great deal of time talking to you about his credentials, about his value, about his contribution to the IJIS family, about his support of our mission, about his support of the broader constituency of health and human services, of even substance abuse programs that we're doing in Fairfax County, but we wouldn't have enough time. And I will tell you that that is the caliber of individuals that we have on this panel. That is the caliber of individuals that we have participating in this event. To speak to you about the facets or the domains that are represented in the conversation that will come next, we have a representative from education from the San Mateo County, California, Silicon Valley Education Group. We have higher education represented, and we have public safety represented from Newark, New Jersey, major city, East Coast urban area that has continued to deal with the surge of the pandemic. I'm not getting too much into each of the individuals because what we thought best is, since they have such a commitment and such a vita, we wanted them to, at the appropriate juncture, discuss their own backgrounds, discuss their perspectives, and then get into the meat of the discussion. So without further ado, I pass it to our good friend, Dr. Bill Hazel, and we will be back to usher questions and to provide you more feedback. Thank you.
Thank you, Maria. A pleasure to be here today, and welcome everyone. I think this will be a very interesting panel. It was certainly interesting putting it together because of the varied backgrounds of the individuals involved, and trying to find and flesh out the common themes was a bit of a challenge, but they're there, and I think it will be instructive to everyone. The topic of sharing data, targeted, selective data sharing to provide actionable intelligence for your mission, is something that's been talked about a lot at IJIS over time across domains. So the question then is, you've designed a system and you get it working a little bit, and along comes COVID, and suddenly everything changes. What do you do? How have you responded? What lessons have learned in assuming that normal is not going to be what normal was? What lessons are we going to take forward from this as we go forward? And then what systems need to be in place? What do you need to help us put together to make all of this work? So we're looking forward to getting questions, hearing your comments as we go. Please jump in. I explained to the panel that this will be fairly unorganized, but that should give you plenty of chance to just pipe in. I do want to level set here for a moment. Most of you will understand that Anthony Ambrose is Director of Public Safety. We know what he does, or at least we like to think we know what he does, but most of us may not have a good understanding of the Silicon Valley Regional Data Trust, which Rodney Ogawa, Dr. Ogawa was one of the founders of, and which Jeneé Littrell works in. But the Silicon Valley Regional Data Trust was established to improve services and outcomes for children and families through sharing information through multiple agencies. And a data sharing environment was designed and created with IJIS help. Steve Ambrosini and Richard Gold helped with that. That was in the process of being implemented when COVID hit. I will point out now that there are two new grants, one from the Department of Justice, another from the Department of Homeland Security, that are going to create the first implementation instance in San Mateo County where Jeneé Littrell works. So wanted to let you know what that is, and you'll hear some common themes about organizing multiple parties between the education folks and between Anthony Ambrose as we go through, even though their domains are quite different. So to get us started, we'll have Rod introduce himself and tell you a little bit about what he does and where the Silicon Valley Regional Data Trust idea started. And then Jeneé will pitch in and tell about what she does. And then finally, we'll get to the director, Ambrose, to tell us all what we meant to say. Rod? No meeting is complete without saying you're still muted. For those who were on the call earlier this morning, we witnessed technical difficulties. So we'll probably have a few of those. Go ahead, okay. Rod.
I'm now unmuted. I'm Rod Ogawa. Good morning, everybody. And I am currently Professor Emeritus and Research Professor at the University of California, Santa Cruz. Prior to my retirement a few years ago, I was Professor of Education in the Division of Social Sciences at UC Santa Cruz. I was chair of the education department and director of the Center for Educational Research on Underserved Children. And it was sort of an extension of my work in that role, where I got together with a team of faculty members as well as two individuals who had been working in public schools in Santa Clara County to develop a data warehouse to serve one major urban district in San Jose Unified. And we got together, and I had decided that, having done research for 40 years, that I wanted to do something that would make a direct difference in the provision of services and improvement of the infrastructure supporting public education and health and human services. So we put together a team of people from UC Santa Cruz. And my other intent was to draw on the resources of the university and make them available to the community, to the local community, which doesn't always happen. And so we received a planning grant from the National Science Foundation. And with that, we began to plan what eventually became the Silicon Valley Regional Data Trust. And our intention was to develop a system drawing on resources in 3 counties of Silicon Valley: San Mateo in the north, Santa Clara, and Santa Cruz counties, to enable public education, public schools, and health and human service agencies in those 3 counties to share data across agencies and across counties to improve services and coordination to children and families, particularly those typically underserved by the system. And so with that, for 2 years, utilizing NSF funding, we began meeting with agency and public education representatives, usually top-level administrators across the 3 counties. And the first thing that became really obvious was that this was all going to be, this would be based upon the construction of trust, beginning with the development of trust between individuals, building on that to develop trust between agencies and across counties, because people get really nervous about data. And so we thought that only by working together, and it's kind of ironic that the university served that initial role, because we tend to sort of sit on the hill, in our case, Santa Cruz, literally, and look down at the world. But in this case, we drew on the resources that we had through the NSF grant to do the work of building a network of representatives from the agencies and public schools to begin developing the trust on a face-to-face basis, and thus sort of institutionalizing trust across agencies and across counties. One of the things that became apparent as we began thinking about moving to the next stage, which would be to design and construct the Silicon Valley Regional Data Trust, a computer scientist on the faculty in the engineering school at UC Santa Cruz took me aside and said, Rod, he says, you're going to want to move fast, and you're going to want to be able to design, build, and operate a system more quickly than university faculty typically can. He says, we like to sit around, wring our hands, and think through everything to the point where sometimes it solidifies and nothing happens. And so it was at that point, fortunately, we were introduced to IJIS and to Steve Ambrosini, who was the executive director at the time. And we quickly became partners with IJIS, and through Steve, received the kinds of technical support that we needed to design and develop the data sharing system. And also through IJIS, we received the services of our counsel, Richard Gold, who is a consultant with IJIS. And so that partnership led to the next phase, which was funded by a grant from the Chan Zuckerberg initiative. And so over the next 3 or 4 years, that core team worked with representatives from public education, the 3 county offices of education in particular, and the directors of health and human services across the 3 counties to design and develop the data sharing system. And in all of that, as I began, on the topic of trust, we developed a particularly strong relationship with San Mateo County, led by the administrators there. And we had been warned that watch out for the lawyers, because if anybody's going to stop this, it will be the lawyers. Well, it turned out that County Council in San Mateo became one of our chief drivers in San Mateo, and through her, we gained credibility and the trust of top-level administrators, including the people in the County Office of Education. And for that reason, once the system was developed, the first implementation, the pilot as we call it, is occurring, as Bill reported, in San Mateo County.
Thank you, Rod. Appreciate it. Now we'll go to San Mateo County, and looking through Jeneé's window back there at all that nice scenery, and we're expecting snow here in Virginia tomorrow. So Jeneé, you're fortunate. Welcome.
Yes. Thank you. And I'm so happy to be here. I am honored. And as I'm listening and preparing, as I was preparing for this session, I was reflecting on my career. And I think it's really important as a frame. Our superintendent is Nancy McGee. I'm the Deputy Superintendent for Educational Services here at the San Mateo County Office of Education. But she and I first met 20 years ago at Santana High School in San Diego County after we had a shooting. We had a freshman come to campus and bring a weapon, injured 13 and killed 2 students. I was then one of the key leaders in bringing the recovery process to that campus. And as you can imagine, this was actually the first major shooting after Columbine. And the more that we were helping the school recover, and the more we understood about the student that perpetrated this heinous crime, a freshman, we understood that this student was known to multiple other systems. We learned that the student came from a district outside of our area, and the student was known to child welfare, was known to juvenile justice. The family had some involvement, but we didn't know that. So in essence, we had a student with lots of risk factors enter our campus and not receive the appropriate support. And then because of different other elements in his life, chose one day on March 5th, 2001 to bring a gun to campus and act out his pain. And in doing so, he actually took the life of 2 students. And it was that journey that made us really think, what if we knew? What if we had this heads up from our partners about what the student needed? What could we have gotten ahead of? And then here we are 20 years later, Superintendent McGee and I are continuing this journey around sharing information, partnering with systems. We have to leverage our workforces. We have some information. We work hard to gather more information, but we only have what we have unless we get our partners, our law enforcement partners, our child welfare partners, our mental health partners, to really come to the table. And it was mentioned, we don't want to violate confidentiality. We don't want to violate educational laws, FERPA or HIPAA or any other laws. But in essence, what we were finding is that our professionals were being way more restrictive than what the law required. And that we had legal ways to come together and share information and get ahead of what risk could be coming to an individual student or to our campus. And so we actually continued the journey. Part of this journey included identifying children that were trafficking victims, and it was because we had the trust. As Rod just mentioned, we had the individual trust across our systems. We had the agency trust across our systems. And so while I was still in San Diego County, started to see and understand that we had students on campus that we might have historically looked at as acting out in traditional ways. Maybe that's just, a teenage, argument or a bad relationship. And what we started to understand because of the information from our partners is we actually had human trafficking happening on our campuses. We had the recruitment, we had the exploitation, and we would not have understood it or known what we were dealing with had we not had the trust and the ability to share all portions of the problem. So in that relationship, we actually developed a whole mechanism to share information. For instance, we found that by the time we identified a victim, they had already had 2 runaway reports with law enforcement. They had already had 5 child welfare reports. There were different data points that our partners were aware of, but we didn't understand the whole scope and we didn't understand how to see the data. We saw attendance challenges, truancy challenges, but once we came together, we were able to kind of create a profile of a student of concern. And so we've continued that work, and yet we weren't able to really create the system until we landed here and joined this partnership with the Silicon Valley Regional Data Trust. And now we have a legal framework. We have our data systems feeding together, and it always will take trust. It will always take the relationship, but it can be systematically happening in a much more robust and responsive manner. And the system is now the system that allows us to do the work that we've done for 20 years, but to get ahead of it and to actually be able to sit with the technology and the relationship to support the students. However, then COVID hit. So we developed the trust, we had the data, and then COVID hit. So in our county, we saw a 90% decline in the reports going to child welfare. We saw all of our systems have significant mental health had an uptick in their referrals. And we didn't have attendance data anymore. We didn't have some of the things that we grew to get really comfortable with. So here we had worked so hard to build the system, and then the environment changed. And that's what I'm really excited to talk about today.
Okay, thank you, Jeneé. And I think going from Rod in higher education, even though he is from the left coast and has a necktie on, from higher education to education, we see the real issues of how we address kids with troubles. And that does involve juvenile justice, it involves law enforcement, it involves human services, and people who are in the community where the schools may not be, in their homes and so forth. I would like to come back to Jeneé in a minute and ask, and we always referred to education, which had a very tall building in Virginia, as the Tower of No. So we'll need to talk a little bit more about how you overcome no. But let's go to Director Ambrose. Director Ambrose, welcome.
Good morning, everyone. Doctors, Jeneé and Maria, and thank you for the opportunity. Let me begin by saying information sharing in my business. I've been in business for 34 years in public safety. It's vital. It's a vital role. And I think that it's important that we share our information, and our data systems are important, not only internally, but to other agencies, law enforcement agencies, and also to the community. We learned that since 9/11, since 9/11, a lot of data systems and a lot of changing has occurred with the state, our federal, our county partners. So more than ever, it's needed. But I have to say, COVID comes, and I think the trust was built. Normally, public safety information was always given. It's territorial. You don't want to give information out because of the fact, unless you know someone in the state police or you know someone in the FBI. And we got past that. But then, COVID comes, and it was kind of hard continuing to build trust with our community. So we had to figure a way to where we did things in person. We had to do it through Zoom and through conference calls. And that's something that we were able to do. You might have some background music, some background noise. I'm sorry about that. But what happens is, it's more important than ever is that the COVID information that we were getting from early on, from people that were being tested, we were able to map all our testing where it was being done in the city, all our positives, all our negatives. We were able to test it. We were able to map it. We were able to also put into our computer-aided dispatch systems where, in fact, people were that were infected, to let our police and fire know. And that was important. People in the neighborhoods wanted to know. We didn't give a name of an individual, but we were able to put by zip code, saying your zip code, X amount of people are infected, or a high rise, X amount of people. So we went from, we have a real robust data sharing for criminal intelligence and for community engagement. But however, now we couldn't do it live. And then we were stuck with a new 800-pound gorilla in the room, and that was the pandemic. People were not concerned about crime. People weren't concerned about target hardening tips. People were concerned about the pandemic. So we had to shift modes. We had to go into pandemic mode, and we had to do crime mode also, and intelligence sharing. And I think that when you look back in our field in law enforcement, the fusion centers that became very popular over the last 22 years are important. It's an information bank that supports each state. In New Jersey, we have the ROC, the Regional Intelligence Operations Center, that the state police mandate. Rick Fuentes started that when he was the colonel in the state police. I think that's important. That sets the stage for the county. It sets the stage for to the municipalities on the data sharing and information sharing. 34 years ago, we never thought that we would need a whole group of people internally to be engaged in data entering and filtering this information and sending this information out. So on the internal side, then we have our law enforcement partners, and then the community. The community now with social media and the information that could be shared, they look for it. They want it. We have to make sure that they have it daily, and it becomes real time. If you look at crime now, crime fighting, it's real time. If you look at information sharing with the community, it's real time. And I think that builds trust because it comes with transparency, because you're giving accurate and timely information to the public, and that goes a long way. It's also with our news, talking to the news and our media. It's no more the next morning you're reading in the paper. It's as it's happening, they want real time to get out there. So data sharing and information sharing internally to our partners and to the community is really, really robust, and we have to continue doing that. And we have to get over this hurdle. The new thing now is, tracking where people are getting their vaccines, where they live, versus where who's positive and where the vaccines are being given. What's the results from the vaccine? So we have some added responsibilities, but with the partners that we have, we were never so fortunate to be have a partner in health. We would be partners in, the road department and public works, health very rarely. And for the last year, one of our biggest partners in the city and in the state is the health department. So, it's interesting times, but I think that the framework was there for data sharing prior to this pandemic, and we just plugged in some of the pandemic information that we can get out to our public and internally to our people too. Thank you.
Thank you, Anthony. When we had our talk on Saturday and you were filling me in, this got to be really personal, this COVID thing with you all, because of your illnesses and your deaths in your team. Do you want to tell the audience a little about how that impacted you?
Sure. I don't want to bore them too much, but we've had over 380 police and firefighters that were positive with COVID. We lost 8 police officers, died from COVID. We buried, 2 weeks ago, we buried our 8th police officer. So when you have 380 people that are out of work, it's a strain on the current people that are working. You get that burnout syndrome where we put them on 12-hour shifts. So that was a job in itself, keeping the men and women of the police department and the fire department, because I oversee both, operating, giving them weekly messages, personal messages through our system in the department. So it was a strain on us, a major strain. We did come up with a wellness unit where police and fire would go around checking temperatures, doing rapid tests on our individuals that are working. We did all our prisoners are all given rapid tests for their safety and the safety of the officers that are handling them. PPEs are mandatory, like in most states and municipalities. They have to wear their PPEs. So it was a game changer for everyone, including myself, and we had to get used to it. And here we are, almost a year later, and it's almost the norm, wearing PPEs and social distancing. But it's still a threat that our officers deal with every day, going out there dealing with the public. And we lost the 8 officers, and that's still. Some of them are still on respirators and still didn't come back to work.
It's a tough story, and I'm going to come back in a minute, but Anthony, and you might want to tell, as you think about COVID, what you've learned from that you will take going forward, and what systems are going to need to be in place to sort of protect your people as well as the public. But I'm going to come back to you with that one. Jeneé, going back to you for a moment.
Okay.
When we talked, you mentioned that the challenge was that the systems are built around it is the school, and suddenly the kids aren't in school anymore. And how have you adapted to that? And what do you think will be lessons that will be taken forward out of that with you?
So I would say we adapted in 2 ways. One is we had to work with our educators to help them think differently about how they were assessing the needs of their students via online. So we didn't have the traditional indoor, outdoor, eyes-on ability to, do a human radar check on our students. We didn't have the ability to have conversations as students were coming in and out of class, which, so often it's our educators who are detecting other risk and other concern. We knew that there was still some abuse happening. We know that there's still abuse and violence happening in the lives of some of our young people. But again, as I mentioned earlier, we had a 90% decrease in the number of child welfare reports because our schools were not in session. So we partnered with our partners, such as child welfare, our mental health partners, et cetera, to help them better train our educators to understand what do risk factors look like in this new environment. So we had to, adjust our own workforce, but then we also had to help our partners understand what we need to support young people in this new environment of learning. So we are still adjusting and adapting and learning, but because fortunately we have the relationships and we have the Silicon Valley Regional Data Trust, we have everybody at the table. And so I'm confident that the way in which we've been able to pivot and respond to the need, which we're still responding to and it's still morphing, is because we have the strong foundation and investment and an understanding that we can't do it alone. And that our systems, collectively, we see the whole child. Collectively, we see the whole family. collectively, we have the ability to leverage our relationships, leverage our talents, leverage our skills, leverage our touch points. And yet, so we have to be more intentional. So for instance, I saw that somebody had a question around how do you work around sharing laws with juvenile justice? So with our information sharing agreement in our environment, we don't violate any laws around confidentiality and privacy. So my school personnel aren't going to know why a young person is on probation. They're not going to know what crime was committed, but they're going to know that that person has a probation officer. And they're going to have the ability to reach out to that probation officer and co-plan along with what other agencies are involved in that young person's life. Because one thing we've learned is that we were unintentionally adding to the stress because we weren't coordinated. So many folks were contacting families with the same questions, and we were draining our resources, but more importantly, we were stressing out already our stressed and taxed families and students. So we are learning that our practice needs to change. We are learning how to change it. And we are, honestly, it's you're watching us. We're morphing as this is unfolding.
Yeah. Thank you, Jeneé. I found when I was secretary with Human Services, the interactions with schools are really important, but we have to remember kids are out of school more than they're in school. So, and one of my agencies was behavioral health. So when we come back, you talked about the impetus for this for you was threat assessment and the shooting, but tell us when we come back to you a little bit about what the kids are currently experiencing, failing to thrive in school, suicide, things like that, if you will. Rod, having heard these, is your vision working?
Yes. It's working in San Mateo. And I would underscore the importance of the leadership exerted very early in the development of SCRDT by San Mateo's top administrators, both in public education as well as in the county agencies. Two people, just as examples, I had mentioned that county council had in other places sort of dragged their feet because they were very wary of the potential risk that county government could face with the data sharing system, at least as they perceived it. Whereas in San Mateo, Claire Cunningham, who is the county council there, was the one who really led the charge. So much so, we came to count on Claire so much that behind her back, we were calling her Saint Claire, because every time friction would start to develop in the system, she would step in and grease it, and she would do it quietly and directly with her colleagues, and it proved invaluable. And that's why we're working successfully in San Mateo now. And then another example is Ann Campbell, who was then and now retired county superintendent. When we started designing and developing SVRDT, she said to me after a meeting of our executive committee, she said, well, we've got to look for funding now to actually design and develop this thing. Do you think it would be worth our while for me to introduce you to Priscilla Chan, Dr. Priscilla Chan? And it was through that introduction that within 4 months we had funding from the Chan Zuckerberg initiative. So that San Mateo is leading the charge now in the first implementation of SCRDT is a result of the leadership provided very early on, and it continues with the successors. And that's why we're there. And it speaks to the importance of the combination of trust and then leadership among the public agencies and public education in installing and operating a data sharing system. So.
Okay, thank you. Anthony, are you still there? Your screen has gone up on screensaver. he may, his day job doesn't give him time to get away. I can tell you that. So Jeneé, let's go on to you. A little bit about the things that you're seeing now that are threats that need multiple disciplines to address.
Sure. So one of the things that we're seeing, and it's not just us, we're seeing it across the nation, is a significant increase in the number of students that are struggling with suicidal ideation, that are struggling with depression and anxiety. And we had some mechanisms in place within the school system to address that. But again, that was within the school system. And we had some partnerships, and the Silicon Valley Regional Data Trust was helping us better strengthen the way we were supporting students. And then the pandemic hit. So again, we are intersecting this mechanism that we had developed, and now the need just exponentially grew. And so one of the things that we are trying to understand what is the impact of COVID is, for instance, suicidal ideation rates, students that are being hospitalized and assessed, students that are experiencing anxiety and depression. We're seeing a significant number of students our GPAs, our D and F rates in our school system have just jumped. They're not thriving, and many students are barely attending. And when we do an analysis, it tends to be exacerbated by certain demographic areas, certain zip codes. Our English learner population is disproportionately struggling at a greater rate. So is our students experiencing homelessness, our students involved in the foster youth system. So as we take our data, we thankfully have a way to do some cross analysis to determine what our young people are experiencing. And then again, how are we going to respond to those? And we're figuring it out together. We unfortunately didn't have enough time in really implementing our new data trust model independent of COVID, right? To have a really strong example of how it was making a difference.
You mean you didn't plan for COVID?
Right, exactly, exactly. But I am confident that the way in which we're responding is much faster, and the way that we are building systems to hopefully mitigate the harm is actually, I'm confident, is much stronger.
Mm-hmm. When we get back to you, Jeneé, we might want to think a little bit about some of the questions Roger's asked. What outcomes are you looking for that you can measure, and then how would other domains help you measure your success? That might be something that would be useful. Director Ambrose, you're back. But you're muted. I can't tell whether you're saying something or not, but you're still muted. While you're sorting.
Hello?
Yeah, now you're there.
Okay, I'm sorry about that. Go ahead. Sorry about that.
That's all right. Was going to go back to you for a moment, and I know you had to drop off for a second. I explained that your day job does keep you busy.
Yes, it does.
In terms of what you've taken away from the COVID epidemic and response, what do you see will be the consistent needs going forward? Things that you've learned that you might not have thought about without COVID?
Well, first of all, I think we're going to be, as we all know, I think we're going to be, this COVID syndrome is going to be here for a while. I think the most important thing internally, and it also affects externally with COVID, is we have the most contact because we come in contact with people. That's our jobs. I think contact tracing and sharing that data is going to be very important. As you know, right now, public health is tracking it. We have people that are assigned there. But I think one thing it has to be done is self-monitoring, educating the community to self-monitor, and I think there has to be data systems in place permanently for contact tracing and alertness almost like the future is going to be, you get a text message that you were in the company of someone, you should self-isolate, but something has to be done, because that's our biggest thing. I mean, come from a city that, we have about 5,000 index crimes a year, and that was the flavor. But now, since the pandemic, our 911 systems are more flooded with people worrying about people that are living in their buildings, living next door to them, if they can catch. It's actually a public health issue, but they call the police because we're available 24/7. So I think there's got to be data systems put in place for the residents to continue that trust, so they have information real time, 24/7. Not everybody has a computer. A lot of people do have cell phones. We have to think about our elderly. Our elderly counts on TV or radio. So there's got to be a learning curve and information sharing, probably for the next 3 to 5 years with this pandemic. And internally, it's easier with our staffs because of the fact that we have computers and we have Zoom, but a lot of our residents don't have that. So I think the biggest thing is going to be contact tracing and getting the information out to people and other underprivileged people about the pandemic.
Yeah, thank you. I would observe, having been secretary, a couple of things. First of all, during my 8 years as secretary, I tell people I had everything from anthrax to Zika, including Ebola, MERS, SARS. That goes along with your hurricanes and your tornadoes and your snowstorms and all that stuff that public safety deals with. So this isn't the first emergency we've had, and these emerging diseases are real. And I think what the superintendent, I'm going to call you the chief, Anthony, I'm sorry, but I'm just used to calling you chief.
That's all right.
What the director has said is that the police are called because they're the first available, and that's true for behavioral health. The police are called first. It's true for domestic violence. It's true for most of the things that we deal with in the social services and human services world. And I think Jeneé will probably indicate that her teachers aren't at home and they aren't the ones that come to the house at midnight when there's a problem with the kid. So this, I think, we made the case for really thinking about how we build. So to Roger's question about key outcomes and so forth, a lot of things impact how people do. But I was going to go back, Jeneé, to you in specific outcomes, and then for you and Rod, David Shipley's asked a question about legal counsel and how you address the state legal framework. And if one of you could speak to that, I'd appreciate it. But why don't you go first on the what does success look like for your project?
Sure. So when we first started adopting our new data system, each system developed our own metric points that we were looking to analyze, to gather and analyze. So for instance, for us in education, we were hoping to see an increase in attendance, a decrease in truancy, and there's a difference between attendance and truancy. We were looking to see a decrease in behavioral referrals on campus, and hopefully an increase in academic performance. So we looked through our academic lens and we put together metric points that we were hoping to analyze and assess, as did our partners. So mental health, same thing. So they were like, and we had also had some mental health indicators, but then our juvenile justice partners, everyone did the same. However, then we came together and we started to inform each other because we now really understood the extent to which, for instance, originally we did not have participation in pro-social activities such as athletics and clubs and other kind of extracurricular activities on campus. That to us was not one of our foundational metric points. But our mental health partners, that was something that they asked us to collect, because understanding and looking through the mental health lens, when they have young people involved in these pro-social positive experiences, they get more connected and they tend to have less incidences of anxiety and depression, and they stay stronger, more connected to their campus. So each system developed our own, and then we came together and shared. And for us, probation has a very strong interest in ensuring that their students are in attendance also. right? So do our mental health partners. So what was very clear is what felt like our own discipline-specific metric point. It became clear that these were all shared, that each of our systems will do better, and more importantly, our students and families will do better if we're looking across our systems to support.
Thank you, Jeneé. I think the concept that became another one of the Bay Area concepts that we used in human services was this concept of collective impact. And I say Bay Area because the article on collective impact came out of Stanford, and it's set goals and then determine what your common measurements are. That and even though each group can work independently, they're looking for similar things. So I'm thinking about that while we're there. So can you talk a little bit, Irad, are you about the legal issues
Yeah.
around data sharing?
Right. As I heard the question, it focused particularly on state regulations. And in fact, with SVRDT, we have a fair amount of experience with that. And again, we did address state requirements with regard to data sharing across agency lines and across county lines. And here again, the trust we developed with local administrators was key. The county superintendent in Santa Cruz County introduced us to our local assembly member, state assembly member. And he was very interested in the work we were doing to share data across agency lines and across counties. So the first thing he did was he sponsored legislation to name SVRDT as a pilot for the state in the sharing of data across agency lines and across county lines. We then, with the support of our council, we looked at state code, and state code already allowed for the sharing of data across agencies and public education within a county for specific reasons. And so we built into our legal agreements with the participating county agencies and schools that language. So we directly addressed state code. We also discovered that while state code allowed for the sharing of data across agencies within counties, it did not afford support for sharing data across counties, which on its face can make some sense. But we knew that with SVRDT, sharing data across counties is critical, particularly for underserved kids and their families who often live in poverty and face a lot of economic issues, which causes them to move from house to house and from city to city and from county to county, particularly in a region like Silicon Valley, which is sort of netted together so closely for economic reasons. And so that was a barrier. So we went back to our local assembly member and said, is there something you could do? So he sponsored a bill that would expand state code to not only allow for data sharing across agencies, but to also afford the opportunity to share data across counties under specific conditions. And so we were called to testify before the state Senate, and we pointed that out to them. And so rather than opening the door completely, what they did is they adopted legislation that enabled SVRDT alone as a pilot to share data across counties as well as across agencies.
Thank you. One specific question from David Shipley is who is your legal counsel? And I know David, Richard Gold, who is also on this call, did participate in that. Richard is, I hate to say it in his presence, but he's very knowledgeable and very good and very articulate and works well with people trying to solve these issues. So Richard, please ignore the compliments in there. But Rod, did you get real legal counsel from anybody else?
Well, right. Richard was central to the work we were doing in ensuring that the work that SVRDT was doing was consistent with any legal requirements. So, all major props go to Richard.
Okay.
He also navigated what can be tricky waters in working with the council from our 3 counties and their various agencies. And we received, as I said before, legal counsel and support from some county council. And so, yeah, so our legal advice came mainly from Richard and through his work with county council, but there were instances where we worked directly with county council who were very, very familiar not only with the legal requirements locally, but also at the state level, who gave us advice.
Okay. Thank you. David, I do know that Richard is working on a project around data sharing in Fairfax. It's within one county between domains, but the thought is to be able to go interjurisdictional. So the answer to your question is yes, that I think he's still providing counsel. So that would be there. And Richard did have a question about equity. I want to come back to each of you about how data sharing can support moves to improve equity. But Director, one call was here. How do you all address in public safety? You get a call for service, and how do you determine if there's mental illness or you need some other expertise that to go with your officer? You are now muted. We'll let you, let's start, Jeneé, on equity while the director is unmuting.
Sure. For us, like many education systems, we find that it's our underrepresented groups, our students that experience homelessness, our students involved in the child welfare system via foster youth, and again, students, English learners, newcomers to the community that are not performing as well academically, and again, have many of the risk factors that we talked about. Poor attendance, et cetera. So for us, we see this as a tool to really help us get ahead of it and to look for trends and to find effective practices. Because now that we have a tool for the county, it's not just each district in isolation. And just as context, California has 58 counties and we have 1,000 school districts. So for us in San Mateo County, we have 24 school districts. So to go to the County Office of Education, you're going to be able, and through our county council, Deputy Chief Cunningham, or St. Clair, I guess, we now were able to bring the 24 districts along. And now this is consistent across our county. But the other part is, frankly, we had to understand that bias is part of our systems, and bias is part of the humans who work in the system. So as we were developing mechanisms to share information, we did not want to just inform schools of which students were on probation and who their probation officer are. We wanted to get ahead of it and make sure that our administrators or any other staff that were appropriately having access to that information were not using that information to bring a biased perspective to that student. What I need to get that student off my campus. No, instead that information was explicitly and continues to be explicitly shared to support the young person. So in our threat assessment model, where we have a threat assessment team that analyzes threats across the county, we stated explicitly at every meeting that our goal is to reduce the likelihood that a young person will be connected to the juvenile justice system. It's an explicit goal. However, when that is necessary, we don't stray away from it, right? But we don't want to put our partners, such as law enforcement or whoever, in a bind, because as Director Ambrose just talked about, they are the ones that are responding to everything. And we don't want that to be the case. We want our partners and our different disciplines and our different expertise to come to the table to support that young person and to keep the schools and communities safe.
So the answer, in one way, is having it very clear in your goals that,
yes,
that equity is part of it. But I think this is going to go back to what Rod talked about with trust too. I know in the COVID thing, what we've seen is trying to develop some trust around even immunizations, and certain populations just will not trust it. Very difficult things to do. So we can come back a little bit about how you address that. But I believe Anthony's back online. Nope, I don't think so, Anthony. So, not sure how to help with that actually from here. So let's go back to, if we can, the trust issue. You know, it seems to be a thread through all of these things. How do you develop it, and with whom? And you know, Rod, I know you've had some very specific concerns about that as you've worked through the process.
Right. Well, let me go back to the previous question first, and then we can go from there.
Okay, sure.
Yeah, and this is about the building of trust. As I said earlier, our strategy from the very beginning was not to design and develop a system and then impose it or to sell it to our counties, but instead to work directly with representatives from the county agencies and from public education to design and develop the data sharing system that lies at the heart of SVRDT. And so we would have these huge meetings with representatives from all the agencies in the room. And at one particular meeting, 2 or 3 agency representatives stood up and said, look, we will not stand for the data shared through this system to be used against kids from particular backgrounds. And that language has to be written into the agreements and into the basic documents that undergird the sort of legal foundation of SVRDT. And so if you look at our documents, with Richard Gold's lead in developing the legal documents, it states specifically that SVRDT will not allow for the use of data to work against the interest of kids generally, kids and families generally, but in particular against kids and families from communities of color and from low-income communities. So that, in the building of trust, as I said, that's a classic example of SVRDT's approach in designing and developing the data sharing system within counties and across counties. Our core team worked directly with representatives from the county agencies and public education to specify the parameters of that system. And through that, contributed to the construction of trust, both at the individual level. So we could call on people, right, directly and say, okay, look, you voiced concern that these data could be used in a biased way. Here's the language we're putting into our documents. Will that work? And so at the individual level, they would say, no, not quite. And they would push us, and we would respond to their concerns. And then because they represented agencies, and because now their language was embedded in the language of the documents undergirding SVRDT, the trust became, in our thinking, institutionalized, and thus trust was built across agencies and and just as importantly, across time, because agency administrators can leave, right, through retirement or for other positions, or because they're being elevated in the hierarchies of their county administrations. And so to have that institutionalized trust as reflected in the documents and other organizational structures of SVRDT was absolutely critical.
Yeah, that's one thing, Rod, I took from you when you said early on that there was a change in a personnel, that you had a person that you had a relationship with, and then when they disappeared, that trust went. So the key was, how do you go from individual trust to organizational trust, and then, as you say, over time. And I think you all have demonstrated that. I want to jump on over to Anthony while we got him. Have we got you back?
Good.
No, you're still muted. You got to get that mute. There you go. Well, I'm not sure how to handle this one. Maria was said, we can't read your lips, unfortunately. But what I was going to ask is, I think that that Anthony's realm had more issues with trust than anybody else, particularly over this past year, because you not only have the pandemic, but you have all the race issues that have happened. And I know that Anthony, I'm going to paraphrase you, Anthony, you can nod your head. Nobody will hear it rattle. It'll be okay. But he was talking about, in the aftermath of the George Floyd incident, the Newark police actually did very well in responding to the crowds. And he was explaining to me that you have trust with the community, you get started on that early, that were able to share information, and they kind of knew where their trouble was, so they didn't have to go in and start arresting people, locking them up. They were able to work with the crowds. And I just,
Can you hear me now?
Now we can hear you. He
All
got
right.
mad enough he needed to tell you now in his own words.
I think Steve Manuel helped me out. So yeah, what the doctor's saying is, after all the pandemic, then comes the killing of George Floyd. And on May 30th, we had, our first protest in the city. About 17,000 people came. They were, for the most part, about 16,000 were orderly, and about 1,000 weren't. But as I spoke to the doctor and I explained to him, one of our strategies were to use artificial intelligence, not to engage unless there was severe injuries or severe looting, or police officers being assaulted, or civilians being severely assaulted, or arson, just to let them scream, chant, do whatever they have to do. Any minor violations that we would capture it through our artificial intelligence, our cameras, private and public cameras, our license plate readers, our facial recognition we would use. So we were able to, do this. And I think that was mainly a lot of reasons why we didn't have some outbursts, because police, when they take an action, when they see something, not only 2 or 3 cops will go, but if there were 500, all 500 go to that area. So that's just a normal instinct. So I have to say that, and it helped us build trust with the community. One thing that we did see is that the community itself were helping us when they tried to take over one of our precincts. We were able to have intelligence people doing video, and we were able to identify several people who cut and slashed police car tires, where we let them do it. And later on that week, we arrested them with the prosecutor's office and the state police. So I think that when you talk about systems that we had in place and the strategy, I think the artificial intelligence was really, really important. The other part of it is that we were able to share this information live with other surrounding communities that were having protests the same day, indicating if these people show up, this is what they just did at our location. So that was important. The information sharing real time was important. And over the week or 2 after that, 14 days of protest, the information sharing within the community through social media was astronomical. It was beautiful. I mean, they really, really came on board and gave us information, what they heard, what they saw. And we were able to also share that information through the county prosecutor and the state police in the state. And we were able to be in front of it all rather than behind it. And that was important.
Yeah,
and we let the people know.
Yeah, I apologize. Kudos to you guys for doing it, because that trust in the law enforcement is not present everywhere. Nobody saw anything. We hear that a lot in certain areas, but congratulations. Now, Maria jumped on here, and I need to know if that's a warning that we're wrapping up, or
I was actually going to relay some of what I knew Anthony's experiences were, just because we go way back. But I'm just standing by. We probably have another 5 minutes or so for questions, but if we don't have any from the audience, Bill, you know that I always want to know, how could the IJIS community help?
Yeah, well, let me go. We did have 2 questions that I think we could get to, if you don't mind.
Surely.
One that we had asked the director earlier about public safety. How do they address the calls for service and determine the need for behavioral health intervention?
So currently, did you hear me?
Yeah.
Okay. So currently, again, they contact us 24/7, the 911 call center. There is nothing in place at this current time. If someone calls that has some type of mental deficiency or substance abuse, or acting erratically, our officers are trained. We respond. However, under the new Violence Prevention Office that Mayor Barack is starting, it's going to be like a hybrid that I'm actually working with them. So when someone calls that their son or their husband or their daughter has some type of mental illness, that we'll send a social worker and a mental health worker who's trained. The hybrid would be the police, if there's any violence involved, that the police will respond but stay within the area. But the person themselves would see the mental health worker. So that's the way we're designing this. We're also designing where to mirror the police schedules, so they're available 24/7. We may use the call center to accept the call, but the response will be different. Most of the times we see that, not all, but a lot of excessive force and use of force and even deadly force, it emanates from a call from somebody that was non-police, and it escalated into a police matter.
Yeah.
So I think that's important, and that's something that I'll be working with the city on.
Yeah, and I'm going to quick follow up on that. When you have an overdose, do you automatically send a caseworker or a mental health profession to that site with an officer, or not?
No, the only one that responds right now is
Okay.
it's a police death investigation with the medical examiner's office and the police department, and that's it. So some of these things, that thing that the process you just mentioned, these are things that we're going to be looking to do within the city over the next 24 months.
Okay, thank you. Jeneé, David Shipley asked another question about, do you all have behavioral health providers in your SVRDT network? I'm sorry, Jeneé.
We do, and I was seeing his question about how did the organization learn the community's trust. For us in education, we only will know if one of our students is being seen by our behavioral health and recovery services agency, and if so, who the therapist is. We don't know any details, and we don't. If we need to get more details, we involve the family to get an information sharing agreement.
Thank you. Now, to Maria's question. Maria, do you want to ask your question again in the last couple minutes?
Surely, absolutely. I mean, just as we had with the previous panel, there is a wealth of information here. There's a wealth of experience. There's a wealth of problems that were solved. Unfortunately, there's still some gaps, not necessarily that you shared, but I just know from reality, there still might be areas that you have on your individual wish lists, and that as a collective community, we might be able to support. So the question that I always ask, and Bill reminds me that I remind him, is what is it that IJIS community can do to improve your circumstances? This is not a pandemic that hits any one of us. This is not a pandemic that hits any one domain. This is, as Anthony made reference to, it's going to be with us for a while. It's the short term, it's the long term, it's the evolution. So how can we support your needs? And really, that might be a question for all, or whoever wants to jump on it.
Yeah. Rod, you go first. And Anthony, if you'll take Richard's question when you come to him about Overdose Review Committee, I'd appreciate it. Rod, go ahead.
Well, I mean, early in SVRDT's work to design and develop the data sharing system, as I said, we moved away from relying on faculty because they move at glacial speed. And we're fortunate to have been introduced to IJIS and to Steve Ambrosini in particular. And the technical support that he provided and that IJIS provided. And then when Richard joined IJIS as a consultant, our access to him through IJIS for legal services was critical. So, we stand as an example of the kind of direct support that IJIS provides. In addition, I think because IJIS is at the heart of a very large network, and because they do work all across the country, I think the work that we've been doing through at SDRDT has already been shared with individuals doing similar work in other parts of the country. And so for us, I think both to have sort of our experience disseminated, as well as our ability to learn from other locales through IJIS is absolutely critical. And I would add one last piece, which goes back to my university roots. One of the things that we've learned through Steve's contacts and his work with university faculty, I think in places like Georgia Tech and elsewhere, I think one of the things I'm hoping we can continue to do is that work being done at UC Santa Cruz. Faculty in computer science, I found out just this morning, just received a National Science Foundation grant to work to eliminate racial and gender bias in machine learning and the mathematical models that data scientists are developing to help diagnose and to predict situations. One of the criticisms that has been leveled at AI by people who are working to deliver direct services, I know there was an instance in Philadelphia a few years back, is that some of the modeling that occurs using those data has racial and gender bias built into it. And so, the fact that our team at UC Santa Cruz, and I'm sure who are working to eliminate that bias, if that can be disseminated through IJIS, I think would be very helpful and contributes to the construction of trust and addressing issues of equity that were raised earlier.
Okay, thank you.
Absolutely.
Jeneé, and then we'll get to the direct.
I echo very much some of the points that Rod just made. I started this with sharing about my support of the response to the Santana shooting in 2001. And here we are almost 20 years to the day having the same conversations. And yet we've come so far. We now have a tool, we have better understanding. And as Rod shared, we had special real investment by our legal support. And for us in San Mateo, we also had our local congresswoman really champion this work. And all of that being said, it's still not systemic. And we're one of 58 counties just in California. So we are still receiving students from other areas, and we are sending students to other areas, and we are not integrated as much as we should be and could be. And so if we really had the way to systematically make this or something similar to this, the way that business happens, that we understand that we have to leverage each other's, we don't have enough teachers, we don't have enough social workers, we don't have enough school psychologists, we never will. We don't have enough, and each discipline could say the same. But together, we will have more, and our families will be strong, better supported, and we will intervene earlier. So to your question, if we could make this the way of doing business, and for us in education, this is so outside the norm. All of the folks enter our education system through the classroom or through some type of, credentialed position. And then they evolve up to leadership. And to have a grounding and a vision to see that this can be done and it should be done, and the value for us in education, why doing this work does make a difference in that classroom, that will help each and every district. Again, there's 1,000 schools in in California. So how having the support of your community help make this the way of doing business would be my ask.
Wonderful. And we will definitely keep that in mind, because there are ways that we can focus on this solution or on this concept in a more focused manner than these, unique conversations, and would help promulgate the message. So certainly we'll have follow-up conversations, Jeneé.
Okay. You have Anthony, your time for your wish list, besides winning lottery tickets to fund all this stuff.
Yes, exactly.
Well, a lot, what I heard, it's the same here. I look at law enforcement 2020, policing during the pandemic. And I think it's important that Steve and Maria have always been helpful. I think that we have to almost change systems and talk about policing during the pandemic and what law enforcement executives need to transition the internal part, the residents, the community into the information. We talk and also mirroring or bringing as a partner public health. So I think public health has to be involved and has to have the head seat at the table because it's really about public health, the pandemic. But I think the police have to be there with them to carry out some of their mission and some of their tracking. I think that it's important that, I took on the pandemic from the health department. I took on the positives like it was crime. We mapped it, by zip code, just like we do with crime. Then overlaid it with negatives. Then every time we did something, if we had an executive order from the governor or from the mayor, what was the results after at least 7 days we implemented that? Did we see any results? Are we just telling people to stay in their house? Are we seeing results for that? So we could also save lives and sell it to the public that it's working. And I think the information and the overlays by Maria and Steve are going to be information that's going to be needed. And no one's thinking that way. They're doing, they're back to the old PIM maps almost. So I think that's important, is tracking the contact tracing. It's almost now to hit a button, a one-stop shop. And I talked to you about it, Doc, saying, well, the pandemic, how can we hit one button and tell you what area has it, how many vaccines were given, how many negatives were in that area? Once something new was implemented by the governor or by the municipality, what's the results from that? And I think a lot of not only police and public law enforcement and health department, but a lot of our elected officials are feeder to the fire, or their feet are being held to the fire because they're putting so many regulations out there, and the people are getting frustrated. And I think that you have to let the people know the results. And I think more data has to be contained, it has to be analyzed and given out. And I think that's where we're going moving forward. I think that Maria and Steve will be very instrumental in that.
I think, Chief, Director, my observation would be that there's a certain amount of open data that needs to be out there so that people can understand what the results are. I know in California, it was very useful to have open data in addressing a measles outbreak. People who were against vaccinations could actually see what was happening. And so things like that are useful in the open data side, which maybe get to the results. Putting on my doctor hat and the fact that public health was was under me at the state. Public health is sort of a unique animal. And one of the issues is that in many areas, they don't have any sustainable funding. It's all grant-based from CDC. And I think our agency had 180 different grants, all had to be renewed on a regular basis. And you chase your income from the grants. And so staying on mission and building infrastructure in public health is a challenge. And we've seen that during the pandemic. It's probably fair to say that the sign-up system that was developed hasn't worked really very well, or as well as we would have liked. And there's some switches, but understanding that this isn't the first time we've had pandemics, it won't be the last time. How do we build the structure that allows us to recognize early, to do some of the mapping? This contact tracing isn't just about contact tracing, it's about immunizations, it's about who's had the disease, because the risk isn't just because you've had a contact, it's all of those things. So there's a lot of complexity built in that I think raises some significant questions about how we should share information. So Maria, that would be my observation, is how to get in and work on some of those issues.
The good news and the bad news is that this is rich with information to address, and that we do have the right resources available to do so. Whether it's the panelists that we brought together to give us inspiration and their experiences, whether it's the service providers to give us ideas and even their experiences of how they've addressed certain jurisdictions across the country. There is a long laundry list of opportunities to solve problems. So we look forward not only to working with you individually, with you collectively, and bringing in other resources to maybe focus on this specifically, with action plans, because I by default am one of those individuals that likes to know what the next couple of steps are in order to be ahead of the curve and be responsive to the need. So from my perspective, I thank you all so much for your participation and your valued contribution. And we apologize to Anthony personally, and to the committee, and to the entire team. We appreciate all your patience with it, and we look forward to working with all of you and the community in the future.
And thanks to the panel. I've enjoyed working with you very much. I've learned a lot from this, and we'll get back to Richard and Robert's comments offline. Thank you.
Wonderful.
Thank you.
Thank you, everyone.
Thank you. Thank you.
Bye now.
Thank
So as the members of our as the members of our pandemic response team leave us, I share and reiterate the notion that we have a lot that our IJIS community can do in the future. Before we go to what is our panel and response panel representing both industry and practitioners in the next hour, we're going to show you one more sponsor video from Securus and how they are responding to the needs of data sharing, of information sharing, of addressing what are the priorities of the constituents nationwide. So for the next couple of minutes, if we could hold you and have you watch the video, we appreciate that. And we will see you a little bit later this afternoon at 2:30 with a separate video.
I could have never predicted that it was going to happen like this. I was in cell 224 and I woke up at like 3 o'clock in the morning. It was like, I left my kids. How in the hell did I leave my kids? And I cried and I looked out the cell door and I realized that I had left my babies.
I'm super emotional. And I'm not one of those really, really emotional people, but it's happening now. And so I'm just, it's happening.
I don't even remember how old I was when I last seen him. It had to been about 26 years, maybe longer. I'm feeling very anxious and nervous all at the same time. I don't know what I'll say. Not at this moment. It just have to be like when I see him, then I'll know. When I seen him for the first time, I was just like, wow, that's him. Like, I seen pictures and the picture came to life.
Today was the first day I seen my dad in the flesh. Yeah, I thought he was gonna be a little bit taller, you know what I'm saying? But he looks good though, you know, he's in good shape. It's good to see him like that.
This is the JPay tablet. It's secure technology. It allows you to get secure emails, videograms, pictures. And so up until these came, everything was in a snail mail. You know, a letter, you gotta put an envelope and a stamp. So I ordered one and sent the information to my son. He was the first one to send me some videograms of him and Enoch. And I sat there and I looked at that video, I think for 2 days, just all day. Didn't do nothing else, I just looked at this video. It gave me access to a world that I craved, and that was my kids. It became a tool that gave me the motivation. It made me want to be with them. This little piece of plastic changed everybody's life, right? I was in California, and and they had moved to Florida. There's no way for them to come and see me. I don't have a lot of money. They didn't have a lot of money. So the tablet bridged the gap. It felt like they were like right down the street.
It feels good knowing that I actually have a father. For a lot of years, it's like sometimes I just forget that I have a dad. Just ready to get to know him more, get to know my dad more.
For those who are far from their loved ones, to where it's hard for you to go visit them, Securus it helps you out a lot for communication.
And if anybody's serious about criminal justice reform, if they're serious about rehabilitation, then they definitely want to look at making sure that every inmate gets a tablet.